Welcome to the NWAETC Project Echo. I'm Kent Unruh, and I'd like to turn it over to Brian Wood to introduce our speaker today.
Well, a big thank you to Jennifer Manjani for coming, and Jennifer is one of our social workers and part of our Echo panel here, so she should be familiar, and she's going to talk to us about motivational interviewing.
Thank you. I think most of you are probably familiar somewhat with motivational interviewing, but just as a review, it's a way to have a conversation with clients, and the focus is on eliciting the patient's or the client's way of perceiving any sort of problem that might exist. The philosophy is that the patient really is the best one to know how to fix a situation that isn't going well, such as drug use or not taking their medications. The answer to whether or not that behavior will change resides with the patient and not with the clinician. So just a little refresher there. Sometimes I think this is something that we don't talk about, how to sort of ease into these conversations, and it can be a little challenging if you've been working with someone for a long time and you have this rapport with them in which it's sort of a cursory sort of check-in about adherence. How you're doing great taking your medication still? Yes, of course I am. And so then how do you slow that conversation down to get to higher level detail? And I want to go into that in another pre-recorded session, but I think folks may have kind of questions about that too, kind of as we go along. And then how do you set the stage for patients who are just starting HEART to sort of warn them that, I'm going to have a range of questions about how this is going, and the answers that I'm looking for aren't the right answers. I mean, of course, if you ask someone how many doses they've missed in the last 2 weeks, the right answer would be, well, I've missed none, right? But, the reality is what you're looking for is the honest answer. And how do you set up with your client that that's the case, that you are someone who can be trusted with information that says, I wasn't perfect on this, and it's not going perfectly, and how do I tell you that, and how do I get help for that? So I think there's definitely some strategies that we can be using to enhance that. So basic principles of motivational interviewing are using the ORS technique. So you'll see that starts off with open-ended questions. Brian and I are going to role play a little bit. Open-ended questions are where we want to start. You want to do that by, these are some examples of some of the questions that you want to be listening for. If you're really stuck, if there's just no question that the patient is really, they're still giving you monosyllabic answers, sometimes I'll say, well, it just really seems like there's nothing good that can come of making a change here. And sometimes that will spur them on to a discussion, because some folks just are sort of in the zone of being oppositional to any sort of authority, and so to try and push them into a way of responding differently can be to take the negative side. And then using affirmations can be really successful too. I think most folks have thought about making a change and have felt like they were not successful. They perceive themselves as being a failed changer, and anything that you can do to highlight the fact that that's not the case can be useful, because they can sort of see themselves differently and in that. So Brian and I are going to get started in a little role play, and as we do that, what I want to remember, first and foremost is that Brian, I may not understand the reasons that Brian is making the decisions that he's doing, but I have to trust that there is a very, very good reason that he is choosing to make these decisions. So it's easy to say, well, CPS has been out to your house 4 times, Brian. What motivation do you need to stop using crack cocaine? But when I enter this conversation, what I need first and foremost in my head is that you have a really excellent notion in your head about why you haven't made a change, and I need to help you sort of see that and mirror back to you what that is. And you may look at that and decide at that point to make a change. So Brian, I'm so glad you showed up today. I know that last time you were in, you mentioned something about meth use. Do you mind if we talk about that for just a minute?
That'd be okay.
Okay. I think you had mentioned that you were using mostly on weekends. Is that right? How often are you using meth?
Well, I don't use that much. I use once or twice a month. It's not that bad. It's not really a problem.
So you're seeing the meth use as being something that's manageable right now in your life?
Yeah, I don't use it that much, and most days I can still take my meds, and I use it once or twice a month, and I think I need that, because if I didn't, I might relapse and disappear for a while. That's happened before.
Yeah, you've mentioned a couple things there. One is that most days you remember to take your medications. What happens with that? Like, what happens when you're not taking your medications?
Well, the day that I use it, it's sometimes hard to remember. But every other day I do pretty well.
Okay. So you mentioned, too, that the meth use is giving you some sort of boost. Talk more about that.
Well, I feel pretty good when I when I use, and I don't do it very often, so I think it's all right.
Okay. I noticed you hesitated a little bit when you were talking about that. You're enjoying the use, you find it quite pleasurable, but I almost sense, as you're talking about it, that maybe you're hesitating a little.
Well, sometimes I think about it and I wonder, if I'm going to give myself some new infection with it, or if I may get more problems. Or the day that I use it, it's hard to take care of my kids and things. But every other day I do fine, and I think it might be worse without it. So I keep doing it just once or twice.
So you would say that some of the pros are that it helps kind of relax you, it helps you kind of chill out from whatever's going on in your head. But the cons are that you're more distracted, that you're sometimes forgetting to take doses, that maybe your children aren't getting enough attention. Do I have that right?
Yeah, that sounds right.
How do you feel about the meth use? Like, what would make you want to make a change in that?
Well, I don't know. It would definitely cost less money if I quit. I've thought about that,
Mm-hmm.
and I think that if I had some other way to get that same feeling or take that place that couple days a month, I'd probably quit, but I haven't found anything else.
Mm-hmm. Mm-hmm. So the money is a factor.
Sure.
Yeah. What things would you do with the money if you had more money?
Oh, I'd have more to spend on my kids, and that'd be great, and it's sometimes hard to take care of them, so that would definitely help.
Mm-hmm. It seems that what you're talking about too is a lot about the feeling that meth gives you, and you were talking about how if you could replace that feeling, that would be a good thing. Is there anything else that you've experienced that comes close to that kind of high that meth gives you?
Oh, I don't know. It's hard to find something else. But I used to be pretty active and used to do a lot of sports and things, but that all quit with my meth use.
Mm-hmm. And what happened at the time that you started using meth?
Oh, I just sort of got focused on that, and there was a period where I just disappeared for a while on meth binges, and I've gotten better. I've made some progress. I don't do that anymore, but that once or twice a month is just hard to quit.
Mm-hmm. But it sounds like you used to use more than just the once or twice a month.
Oh yeah.
How much were you using back then?
Oh, I disappeared for a week or two at a time, and that was pretty hard on my family and my kids. So that was a lot more.
Yeah, and you were able to dial that back, which is really great. How were you able to make that change?
Oh, lots of prodding from my family, and they were pretty obnoxious about it, and they kind of helped me and gave me a lot of support.
Mm-hmm. So you found your family to be, it almost sounds like kind of annoying about it. Was that motivation enough?
It helped, and then when I was diagnosed with HIV, that helped as well. I was afraid to make things worse.
Mm-hmm. Yeah. So focusing on your health was one of your goals.
Yeah. And
you didn't see your meth use as helping your health?
No, definitely not.
But in what aspect?
Well, I'd been diagnosed with HIV, so that was a shock. And then when I was using so much, I definitely couldn't take any meds, and I knew I needed to because I've seen people die of HIV, and so I know I've got to take them as much as I can.
Mm-hmm. What do you think would help you if you wanted to cut back on your meth use? Like, what would need to happen to do that?
Well, I'd probably need some support and some way to get through with the cravings, because using once or twice a month helps with the cravings, and probably need something else to go to for that. And it'd be tough, but I might be able to do it.
Mm-hmm. So it sounds like you've got some interest in maybe even dialing back a little further. Is that right?
Well, it would help a couple of things. I know that.
Mm-hmm. Sounds like it would continue to improve your health.
Yeah, it could do that, and it definitely give me more money in my pocket.
Yeah. So I just want to call attention to a few of the things that we've been doing. I tried to affirm him when he talked about the progress that he'd already made. It'd be easy to gloss over that and not really focus on the fact that he really cut back his meth use quite a bit, which is no small feat, frankly. And to be only using once or twice a month is really quite significant. And I try and reflect, this is really kind of the key of motivational interviewing, is to try and reflect back kind of what I'm hearing. And you want to do that with both what he's giving me verbally and the emotional content. You're allowed to give sort of gentle sort of options on the table and to sort of see if someone picks them up or doesn't pick them up. So it's not just strictly like a mirror per se. It can be more of a dialogue. But the goal really, if you're doing this well, is that it's supposed to continue the conversation forward. And it requires just a lot of really good listening. The summaries that you want to do, which we didn't quite get to at the end, are just more of a long restatement. And it's not committing him to any sort of plan of action unless he's already given that to me, and he hasn't yet. Right, he's talking about, well, maybe I'm interested in making some changes, but I've got some obstacles. So just to continue the conversation about, it sounds like you've got some obstacles, and do you have any thoughts about how to think about those? Even if he's got no suggestions whatsoever, I mean, the goal is for Brian to go home and think about the conversation a little bit more, and to hopefully over time kind of come up with some solutions or move his thinking forward. Like, hey, I do want to talk about that again, right? I can set this stage, I think, even better by saying, I just want to tell you about it out of the gate. I'm not trying to convince you to stop using math. That's not my job. My job here is really just to have a conversation about sort of the pros and cons of using math and to see where we go with that. And you can sometimes go a long way with that. The thing that becomes really hard to do when someone, and Brian didn't do this, but people will tell you some really strange things, or some things that you're just like, well, that's just really, I really want to jump in here and give you some advice, right? And it kind of kills the momentum of it, because then the goal, of course, is to get the patient to say what their motivation for change is and what they felt has been most successful to get them to sort of continue in that change path. My giving advice interrupts that entire process. So to try and sit on your hands, if you will, and not do that is really the best way to go. And to know that Brian and I were having a very productive conversation as far as these things go, but sometimes it just feels like you're talking to a brick wall, and it doesn't mean that it's not working. You're still asking questions. There's still maybe some glimmer of something that sort of sits with Brian that 10 conversations down the road, he resonates with him, and he's able to go just a little bit farther down that conversation. And to know that these, it's not a one-shot deal. We're not going to have one conversation about your math use, and you're going to be like, all right, I'm done. So little snippets of time in a given visit can make a huge impact. And I put up some trainings there, from in-person trainings to online trainings to different, to a book, too, that has some great little worksheets and phrasing suggestions and that sort of thing in there. So.
Great. Thank you, Jennifer.